So everybody knows what a prostate is. The prostate's that, it's a little organ around the urethra as it goes down. If it gets, later in life, we get hyperplasia, which means the prostate grows, it gets too big. And eventually you can have it occluding the urethra. And so then you get restricted urine flow. And so that can be an issue. And then the other unfortunate thing that can happen is you get cancer of the prostate,
Yes.
which is
Number one fear.
more and more common now, unfortunately. Very treatable if you get it early. But some of these prostate surgeries are going to affect that urethra. Literally, if you're doing a prostatectomy, you're taking the prostate out and you're reconnecting the urethra, so it shortens that. So it affects a lot of times you're going to have symptoms like urinary leakage after that, which means you're going to leak many times throughout the day, especially in the beginning. Sometimes that can take up to a year to get through that process. Wow. But as you'll hear in a minute, we're going to go through with physical therapy, we can drastically shorten that time frame. So 14 to 25% of men report bothersome leakage after prostatectomy. So almost a quarter of them do.
I never had that, but my late father went through that surgery and same complaint.
But if people go through physical therapy for it and do the exercises as recommended, 88% will achieve good results within about 3 months.
I thought you were going to say 20%.
And only 56% if you don't do it. So you're getting a B+ if you go to the therapist, and you're almost 50-50 chance if you don't. So yeah, but I think it helps to know that 1 in 6 men have these issues. So that's 17% of the male population. That's millions and millions of people.
And you're telling me that physical therapy alone, without all these drugs that they're selling, can have an impact.
It can, for sure. And even if you have gone, say you do need to, take the drug or get the prostate surgery, which that's not something you can sometimes avoid,
right?
Because it's the right thing to do.
Right.
You can still have an impact and improve your recovery by doing pelvic floor physical therapy after you go through those things.
Never once did they talk about physical therapy.